Hello, everyone, and welcome back to The Explainer. Today, we are tackling a topic that touches pretty much all of our lives, whether directly or indirectly: alcohol and health. We're looking at the myths, the risks, and the actual reality. Okay, let's dive into this. We're going to look closely at some hard data from the World Health Organization and the NIAA to really unpack what alcohol does to the human body. Because when you actually look at the numbers, and I mean literally look at the raw data, the story is way more complex than the casual stuff we usually hear in passing. To kick things off, let's address something incredibly common. Seriously, almost everyone has Googled this exact medical question at least once. You get sick, you go to the doctor, grab your prescription, and then you think, wait, can I drink alcohol on antibiotics? Maybe you've got a dinner party or a wedding that night, and you're terrified that one single glass of wine is going to completely wipe out your medication. Well, good news first. Let's clear the air right away. The answer is yes, on most of them. According to medical consensus, having a drink in moderation is highly unlikely to cause a big problem with your standard, run-of-the-mill antibiotic course. You know, it's kind of this widespread myth that you have to totally abstain from everything just because you're taking a basic antibiotic for a sinus infection. But, and this is a very important but, there are exceptions. So the crucial point is that you always have to check exactly which antibiotic you're taking. There is a notable exception highlighted in the clinical literature called metronidazole. If you are prescribed this specific one, drinking alcohol can cause some significant, highly unpleasant physical problems. It's a terrible combo. So while the general rule is pretty relaxed, you can never just assume. Always check the label. Okay, so the antibiotic interaction isn't always a massive crisis, right? But the broader systemic impact of alcohol, that absolutely is. Take a look at this number, 200. According to the World Health Organization, alcohol consumption plays a causal role in more than 200 different diseases, injuries, and health conditions. 200. It's not just about waking up with a bad hangover. It's a systemic factor that impacts the entire body in ways we're honestly just beginning to fully appreciate on a global scale. So when the World Health Organization and the NIAAA talk about those 200 conditions, what are we really talking about? Well, we are talking about the heavy hitters. The NIAAA lists some seriously concerning risks across multiple bodily systems. We're talking pancreatitis, which is this incredibly painful gastrointestinal inflammation. It absolutely wreaks havoc on the cardiovascular system, leading to high blood pressure, cardiac arrhythmias, and even stroke. And it doesn't stop at physical ailments. It deeply affects mental health too, playing a causal role in depression and anxiety. The sheer breadth of alcohol's impact is pretty staggering when you lay it all out. Section 1, the liver disease toll. Let's zoom in on U.S. deaths in 2023. And this brilliantly illustrates the specific, sobering reality of that toll right here in the United States. In 2023, among people ages 12 and older, there were 96,610 total liver disease deaths. A staggering 44.5% of those deaths, that is 43,004 individual lives lost, involved alcohol. That's nearly half of all liver disease fatalities directly tied to alcohol consumption. It is a massive proportion, which just highlights how central alcohol is to this specific fatal condition. When we humanize this data and break down those 43,000 alcohol-involved deaths by gender, the statistics feel a lot more tangible. In 2023, this included 27,684 deaths among males and 15,319 deaths among females. These aren't just abstract percentages. Both of these numbers are incredibly high, representing thousands of families affected by a loss that is largely preventable. Section 2, a leading cancer cause. The critical link to cancer. So we just talked about the liver, which makes sense because most people intuitively connect liver health with drinking. But we need to crescendo into what I think is the most surprising and maybe the most important reality check of this entire explainer. According to the U.S. Surgeon General, alcohol consumption is the third highest preventable cause of cancer in the United States. Third. I mean, we constantly hear about smoking, we hear about diet and sun exposure, but alcohol is sitting right there at number 3 on the list of things we can actually control that cause cancer. It's a major driving factor. To put that third highest ranking into perspective, let's quantify what that actually means for public health. Recent estimates show that 5.6% of all cancer cases, so roughly 100,000 new cases of cancer, are directly attributable to alcohol consumption. And when we look at mortality, 4.1% of all cancer deaths, which equates to about 20,000 deaths, are linked right back to alcohol. Seeing the sheer volume of cases versus the resulting deaths really drives home the macroscopic impact drinking has on oncology wards nationwide. Now, you might be thinking, well, that's just for heavy drinkers, right? Nope. This is where the data gets incredibly specific, particularly for women. We are bringing this right down to the one drink a day level. Research indicates that each drink per day is associated with a 5 to 15% increase in risk compared to women who do not drink at all. Let me just repeat that. One single drink per day shifts your risk percentages upward by 5 to 15% compared to total abstinence. It completely challenges the traditional narrative that daily light drinking is entirely without consequence. Wow, okay, we have covered a lot of ground today. We busted that common myth about standard antibiotics, but we also confronted a pretty harsh reality. Over 200 diseases, nearly half of all liver disease deaths, and its undeniable status as the third leading preventable cause of cancer, driving 100,000 cases a year. We've seen how even just daily light drinking moves the needle on your risk. So I want to leave you with this final provocative thought. In light of all this data, knowing what the numbers literally say rather than just what the culture tells us, how do you view moderate drinking? It's definitely a question worth asking yourself the next time you pour a glass. Thank you so much for joining me for this explainer. Keep asking the hard questions, and I will see you next time.